Podcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the Higher Education Center's webinar on ScreenU. My name is Cindy Clowner. I am with the Higher Education Center, and we're really excited about sharing our new user experience and some enhanced features of ScreenU with all of you today. So thank you for joining us. Before we begin, I just want to go through a few housekeeping items. If you have any questions throughout the webinar, you're welcome to send those questions to us through the question box. We'll be answering those at the end of the webinar, but you're welcome to send them at any time. So today we're going to spend some time just really talking very briefly in general about the ScreenU program and what SBIRT is, and we're really going to focus more on the changes that we've made since we did our last release on ScreenU. So we have a brand new user experience for both the students and staff, as well as some new features. So although we will be walking through ScreenU and how to use those features, we will not be showing you today the full screening process. However, we're happy to demonstrate that for you at another time. So we're going to start by talking just a little bit, very briefly, about SBIRT and providing a general overview for those of you who may not be as familiar with SBIRT or ScreenU. So SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And it is a evidence-based strategy that is supported by the World Health Organization as well as SAMHSA as an early intervention tool. So SBIRT has historically been done in healthcare settings, in trauma rooms, in emergency departments, and is an opportunity to identify someone who may be at high risk of developing a substance use disorder, is maybe experiencing negative consequences because of their substance misuse, and provide a brief intervention with that person, and if necessary, a referral to treatment. And so this is what you're looking at now. It's a graphic from the Hilton Foundation, and it just kind of shows you the path of in-person SBIRT. So a person, like I mentioned, completes that brief screening, and depending on how they screen, if they screen at risk, they may receive that brief intervention, or if their use is severe, a referral to treatment. Those that do not screen at high risk receive reinforcement of their behavior. And all of this has historically been done in person. And so there's some challenges to that we're going to talk about in a moment. But first, I want to focus on what SBIRT has been shown to do. And so, as I mentioned, the World Health Organization and SAMHSA supports the use of SBIRT. In fact, SAMHSA provided a number of grants to student health centers across the country to implement SBIRT within them. And a number of studies have shown efficacy of SBIRT among a college student population. And within that, they've seen a decrease in the typical blood alcohol content, as well as the peak BAC level of students, the peak number of drinks per setting a student is consuming after utilizing SBIRT has been reduced. They've also seen the average number of drinks per week be lower for those who have participated in SBIRT, as well as the number of drunk episodes. And although there's a much more significant body of research around the use of SBIRT with alcohol, there is some research to show an overall reduction in substance misuse, including marijuana frequency, when we apply SBIRT to other substances like marijuana or prescription drugs. I also want to note that although most SBIRT has been done in person, there have been studies that show that SBIRT delivery through electronic means has shown to be just as effective as in-person SBIRT. However, although SBIRT is delivering SBIRT in person is fantastic, there's a lot of challenges to doing that, particularly on a college campus. One, in-person SBIRT requires training, so it really uses the foundational principles behind motivational interviewing to elicit change from a person, and so a practitioner that is delivering SBIRT would need to be trained in motivational interviewing. It can be really time intensive because it's delivered in a one-on-one setting with a person. And because of those reasons, it can be really hard to implement on a large scale. And so because of all of those reasons combined, the Higher Education Center was tasked with rolling out SBIRT in a way that was more accessible to college students, and that's how ScreenU was developed. So ScreenU is a web-based anonymous screening. So anyone can take it if they on any of their devices, as long as they are web enabled. So a student can take it on a cell phone, on a tablet, or on their computer. It's brief. It takes 5 to 10 minutes tops for a student to complete ScreenU, so it doesn't take a lot of time. It doesn't require any training to implement. Our campuses that use ScreenU, we typically spend about an hour doing a demonstration and walking them through how to set up the program. But once it's set up, it doesn't require any training of staff to be able to deploy screening campaigns to students. It connects students with vital resources. So we know students might be on our campus for 4 years and not realize how well supported they are, how many resources are around them that they can take advantage of on campus and within their community. And ScreenU provides resources that are populated by your campus that are local to the campus and community to students, so they're right at their fingertips. ScreenU also provides real-time reporting, and we're going to take a look at some samples of that reporting during this webinar. So as a student completes screenings, you are able to see the data on your end as a campus administrator. And there's also some customizable elements, and we'll talk about those as well as we move through our webinar today. So how does ScreenU work? Well, as I mentioned, it follows the foundational principles of SBIRT. And so the way SBIRT works in person, we've digitized that process for ScreenU. So a student starts by completing a brief screening. We have 3 ScreenU programs: ScreenU Alcohol, ScreenU RX, and ScreenU Marijuana. We use the audit, the alcohol use disorder identification test for ScreenU Alcohol, which is the World Health Organization instrument that has a significant body of research behind it. We've used the QDIT-R, the Cannabis Use Disorder Identification Test revised for ScreenU Marijuana. For ScreenU RX, while we were developing the program, we were looking for a tool that one we could tailor to college students, that we could use for all prescription medications, not just one specific kind of prescription medications. And we also wanted to be able to understand the misuse behaviors that a student is engaging in and provide specific feedback around that behavior. And we couldn't find a tool that was out there that did those things. And so we developed a tool in-house here at the Higher Education Center for our ScreenU RX program. So students take this brief screening, they receive feedback that is specific to their risk level. Once they do that, then they move through a motivational interviewing process. So we ask open-ended questions, and we allow students to assess their readiness for change and respond to questions based on how important they feel it is, how confident they are they can make a change, and how ready they are to make a change. And then students receive strategies to reduce their risk of experiencing negative consequences because of their alcohol or substance misuse, as well as those resources that I mentioned that are populated by your campus. So as I mentioned today, we're going to really focus on some of the new features of ScreenU. And so the things that we're going to show you today is probably the thing that we're most excited about, our new icon-driven user experience for students. So some of the feedback we received from you is that ScreenU was very text-heavy, and we couldn't disagree with that. And we know that students and all people really understand imagery, and they pick up on pictures and can digest that much faster than they can reading. And so we incorporated this icon-driven user experience for students, as well as a little bit for our administrators on the dashboard as well. We know that most students are taking ScreenU on their phones or their tablets, and although that was possible with the former version of ScreenU, we really worked hard in making sure that every aspect of the ScreenU experience would be mobile friendly. And so we'll be showing you a few views from cell phones, what it looks like for a student who might be taking it on their cell phone during our presentation today. One of the things that we were challenged with is campuses wanted to be able to test their campaigns without that data being incorporated into their reporting. And so we have provided a solution for that by creating a demo campaign link that we'll discuss when we get to that point. And we also have created enhancements to our identified student features, and we'll discuss those soon as well. So we're going to go ahead and dive right in, and I'm going to share with you some screenshots of the student experience. As I mentioned before, I'm not going to show you the full screening from start to finish. So those of you who maybe are not currently Higher Education Center members and are not currently using ScreenU, we're happy to provide you demo links so that you can move through the screening on your own to be able to see it from start to finish. However, I have included images that represent the vast majority of the screening. So the very first thing that happens once a student receives a screening link is they are sent to a welcome message. And this welcome message is one of those customizable pieces I mentioned for your campus. So although the content here that you're seeing has been pre-populated into the ScreenU program, your campus has the ability to edit this message to make it appropriate for the students that you're screening. You'll notice that we only collect 3 demographic points, gender, class rank, and age. Once a student moves through the welcome message, then they have a gateway question that they respond to, and all 3 programs use a gateway question to start off. So for here, we're walking through the alcohol program today. Have you had at least 1 alcoholic drink in the past 12 months? And depending on how a student responds to this question, will determine what kind of path they go down when using ScreenU. So let's say I'm a person who is in recovery. And so I indicate whether or not I've had an alcoholic drink in the last 12 months, but then I also check that I'm in recovery from a diagnosed alcohol or other drug use disorder box. So if I were to do that, I would move to a page that is specific to students who are in recovery. And these resources are populated from your recovery resources on your campus administrative dashboard. And we'll show you that here in a little bit. So the resources here represent the resources that we have available to our students here at Ohio State. But of course, this page would differ depending on the kinds of resources that you have on your campus. Students who indicate yes, that they have consumed alcohol in the last 12 months will move through the complete audit. So there's a total of 9 other questions that they'll respond to. And so here's an example of what those questions look like. So they'll answer each question and hit continue until they've completed the screening. And then depending on how they respond to those questions will determine what their feedback page looks like. So for this example, the way we responded to the screening, our answers indicate high risk or likely dependent as my risk level. And so here's our first example of using some of those icons to convey our message to students. As a student scrolls down on the page, after seeing examples of high-risk drinking, they have the opportunity to learn more about some of the effects of high-risk drinking, as well as examples of behaviors that would be indicative of potentially a substance use disorder, and that those students should reach out to a treatment professional or a healthcare provider. So the content that we're delivering is the same. We haven't changed that at all. We have just changed the way we're delivering it to clean up the background for students and to provide something new for them to draw their eye to. Once they complete the feedback portion, they move on to the brief intervention piece. We have 3 open-ended questions that we start with that are meant to elicit change. So getting students to consider the reasons why they thought about changing their behavior and what benefits might come from that. So these open-ended questions students can type a response into. They're required to be at least 10 characters, and they're required to answer them. And as a campus administrator, you have the ability to view these open-ended questions in the reporting CSV. Once a student completes those 3 questions, then they move on to our scales that determine readiness. And so we have 3 scales, and I'm showing you an image from one of those. So we ask students on a scale of 0 to 10 how important it is for them to make a change, how confident they are they can make a change, and how ready they are to make a change. And based on their response, they will receive open-ended questions that look at how they responded and get them to think more about why they responded to that number and not a different one. So for this situation, I indicated an 8, that it was important to me at a level 8. And so the question that pops up for me is, an 8 sounds like it's pretty important to you. Who's been supportive of you in the past and how can they help? So it sounds like it's something that's important because they've rated it fairly high. And so let's start thinking about people who can encourage you to make positive changes and what they can do to be supportive. So our goal with these open-ended questions is to help students move further down the scale so that this issue becomes more important to them, or they become more confident in making a change, or they feel that they're more ready to make a change. Because the next page, and one of the final pages of ScreenU, is providing students with strategies for change as well as resources. And I think this is one of the pages that we're most excited about, that we did a lot of work on. So again, the content hasn't changed, but the way that we're delivering it has. So in the past iteration, it was just a lot of text broken up into text boxes. And now we have cleaned up the text. We provided here are the resources that are available. And again, these are populated by your campus and community. But then when it comes to suggestions that we can implement to be able to reduce our risk, we have created icon tiles to be able to convey those messages. So here's some examples of the first half of those icons. So we're looking at, again, these were all listed in a list in the previous version, and now they just give students another way to look at them. So we're talking about low-risk guidelines around alcohol, as well as strategies to reduce impairment. Once a student reviews the tiles, then if they're at high risk, then they finish getting those last resources. So because this person was at high risk, we encourage them to reach out to a recovery ally on campus or to join a support group as well. And then the final page of the student experience is that thank you page. And the thank you page is also customizable by campus. You can customize that message. Students have the ability to download or email that resource page that we just looked at to themselves, so they have a record of their resources. Those resources expand to show the location of the resource, as well as provide a description line, the email address, the website, and the phone number of the resource so that they can easily contact the resource as well. So as I mentioned, we spent a lot of time looking at the mobile experience for ScreenU and making sure that it was mobile friendly. And so when a student uses ScreenU on their phone or their tablet, they're likely to see an image that looks like this. So here is an example of one of our screening questions. So all of the screening questions, you'll see instead of being the answers being 2 across, they're in a single column so that they're much more readable. Students who have the capability can drag across their touch screen on their phone or their tablet to be able to move the marker on our 0 to 10 scales. And here's an example of those follow-up questions and what that looks like from a mobile experience. And then finally, a couple of screenshots from the resources and what that looks like when you're on a phone. So again, the resources line up in one column, and then those icon tiles that we looked at also line up in one column, making it easy for students to scroll through them. So that's the experience on the student side. And I encourage you, if you have any questions about the student experience, you're welcome to input those in the question box, and I'll be happy to answer those for you at the end of our webinar. But now we're going to dive into the administrative experience. So you as the campus professional, what you would see when you are looking at ScreenU and setting up campaigns. So here is our new administrative dashboard. You'll notice that, again, all the information that was on our old dashboard is still there. We've just changed the way you can view that data. So what you're looking at right now is a top-down view of all of the ScreenU alcohol data that we've collected through our higher education center campus or account. And so we've collected 318 screens, and that's in the teal color. Our data by risk level is, and you can compare that to national data. So I do want to point out our data here is what we send out to campuses for demos, as well as what we use for testing, and so it is not necessarily representative of student data. However, the national data is aggregate data that we've collected from all of our campuses who are using ScreenU. So that is true student data. Although it's important to recognize that not all campuses are implementing ScreenU in the same way. And so this data may not be generalizable to the college population as a whole. I want to point out our new menu on the left-hand side. So at the top, you see the Higher Education Center logo, and that logo would actually be replaced with your campus logo. So another way to customize the program. When students take the screening, they will see your campus logo. They will not see the Higher Education Center logo. So each of these tabs take you to a different place in the administrative dashboard, and we're going to talk about them throughout the rest of our webinar. One other point that I want to bring to your attention about the dashboard is on the right-hand side, this is where you control your account. So although you would manage your campus account in that left-hand side, your personal account is managed in the upper right-hand corner. So if you go to the My Account page, this would allow you to change your personal information that is stored within the program, like your email address, as well as make any password changes that you wish to make. Campus administrators have the ability to manage their campus's dashboard, who has access to that dashboard, and what kind of, and the ability to add users and departments to ScreenU. So we utilize the department feature as a way to segregate campaigns and data between departments on campus. So for example, if you're using ScreenU in counseling, you can add a counseling services department to the program, and only campus professionals who would need access to that to the campaigns as well as the associated reporting would have access if they were associated with counseling services department. So it's a way for us to protect data within the campus while still being able to see in aggregate the entire campus's data. We also have a way to add additional users to your program. So you may be the primary contact for ScreenU, but you can have an unlimited number of other professionals on your campus added to be able to have access to the program. And so you can add a user through this page. We have two levels of permissions. We have a campus admin permission as well as a user permission. And so campus admins have access to this Manage Campus page, which allows them to add the departments and add the users, where a user will only have access to the other pages, will only have access to the campaigns as well as the reporting from the departments that they're associated with, and will not be able to make changes to the users and departments on your campus. This page also allows you to make any kind of edits to your campus information. So your campus logo is stored on this page, as well as the contact information for your address or for your campus as well. So when you want to add a department, this is the page that you would see. You can, when you want to manage a department, this is the page you want to see. So we clicked on Athletic Department on that last page, and you can see here the users that are listed under this department. We can add more users to this department. We can remove the department altogether. And this is true for users as well. So we can do the same thing by adding users to the program, removing users, and adding them to departments. Once you have all the people that you want in your program and you have all of the departments set up, you can start creating campaigns. And campaigns are a group of screenings that are sent out to, or I'm sorry, it's one screening that's sent out to a group of students. So we may name our campaign whatever we'd like. We can choose the program. And depending on how we want to screen students would determine how we set up these campaigns. So an example of that is if we're screening all of our student athletes, we could do it in a couple of different ways. Maybe we're just interested in getting student athlete data in general. And so maybe this campaign is entitled Student Athletes, and it goes out to all of our student athletes, no matter what team they're on. But another option is to screen all of our student athletes, but create a campaign that is unique for every sporting team. So you may have women's soccer and men's basketball and so on. And so this would give you targeted information about a specific team versus just student athletes in general. And it's important to be thoughtful about how we create campaigns in the beginning, because as I mentioned before, our screenings are anonymous, and we only collect 3 demographic points. And so those demographic points are the only things that we can organize our data by when we're looking at the reporting. We can select a department as well as a start and end date for the campaign, and the program will automatically activate and deactivate those campaigns based on the start and end date. Below this on this page is also the welcome and thank you message, which you can tailor for each specific campaign. So I just wanted to bring attention again to the departments because this is where you can change those, and only users who have access to that department would have access to this campaign as well. Once you hit create, here's the new page of what the campaign would look like. And so we see the name of the campaign, and initially in our previous version, we could see the screening link that you would send out to students. And we still see that here under campaign URL, but we've made an addition, this demo URL. So if you are, once you have activated your program and you've uploaded all of your resources and you're ready to send out a screening, maybe you want to take a look and see what students will see to make sure that you didn't miss anything. Or maybe you have new stakeholders on your campus that are interested in utilizing ScreenU and they want to check it out and see what it's all about, but you don't want to skew your campus data. That's where this demo URL comes in. So we can send this demo link out to people. They can take the screening. It looks just like what a student would see. However, the data is not collected as part of your reporting. At the end of that campaign page are these 4 buttons, and these are new as well. Although some of the features existed in the previous version, we've enhanced this area with ScreenU, and we've provided some additional opportunities for reaching students through an identified way. So what we have done is we've created a way that you can identify a group of students and send email links to those students that are unique to be able to track completion. So we have a number of campuses that use ScreenU in a mandated sense, for example, with their conduct office, and they use this process to be able to determine whether or not a student completed the screening. So based on what you want to do, we'll determine which button you push. So we're going to start with updating our invite email templates. So this is an email template that is within the program that would allow you to email a group of students a unique collector link that is assigned to just them. And so you have the ability to edit this email template to say whatever you like, although it's pre-populated with the content that you see here. And once you send these emails out, then students will receive this email and the link and be able to take ScreenU, and you'll have the ability to download an identified student CSV, which is that top button on the right-hand side, which will show you a timestamp of when that student completed the screening. Again, the screenings are anonymous, and so this CSV does not have any data related to the screening. It just will show you the email address that you sent a screening to, their unique collector link for the campaign, as well as a timestamp of when they completed the screening. So let's say you've sent this email out and you want to send a reminder to complete the campaign, and we can do that now. So that's a brand new feature that did not exist initially. So when emails go out to students, If they have not completed the screening after a week's time, you can send a reminder, which will allow you repopulate an email that you can edit to send out to them, encouraging them to complete the screening. So how do we send it to these students? Well, the top button on the left-hand side allows you to send the campaign to additional participants. So that's what this is here. You have a couple of options for how to upload email addresses to the program to be able to send it out. So one is to upload a CSV file, which is consistent with what we have done in the past. So you can upload that file with just email addresses. We include a CSV template that you can use, and the system will maintain those emails, again, keeping their data segregated, and we'll use that to populate those emails that go out so that the program knows who to send an email to. We also have the ability to manually add email addresses. And so if we just have a few people that we want to send an email to, for example, if we're using this in conduct, maybe we only have a student every couple of days that we want to send this out to. I'm sorry. We can send this out to students that way by manually adding their email address. On the left-hand side, we can see the current students who have already been added, and then we can continue to add students even after we've deployed the campaign. And again, that's a new feature. Before, once you deployed a campaign with the CSV file, you couldn't add any new students to the campaign, and now you can. So over a semester, you may have all students that you're utilizing this program in conduct with added to this one specific campaign and kept in one place, and we can continue to go back to it even after you've deployed it the first time. So now I'd like to take us back to campus resources, and you see here 4 different programs. As I mentioned, we have 3, alcohol, RX, and marijuana, but we also have a recovery resources category, and those are for those resources that I showed you initially when we indicated that I was in recovery on this sample screening. So you can populate those recovery resources differently if you choose than your ScreenU alcohol, RX, or marijuana resources. Once we go to show all resources, this is what we'll see. So we'll see a drop down of all the resources that we've added. When we've added them, we have the ability to make changes to those resources. Say a phone number or an email has changed, we can click on that edit button next to the resource to make edits. We can also add a resource by clicking on that purple add resource button. And when we do that, it'll allow us to add a resource to one or all of the programs. So many of you are coming from wellness offices, and your resource is probably a resource in all 4 areas, and so you can do that in one swoop. Add your resource to all 4 areas. These campus resources are auto-populated within the ScreenU screening, and so they all show up at some place in the screening. We encourage campuses, although you don't need to populate all of them, we do encourage campuses to populate a specific group of them for the best student experience with ScreenU. And those resources are student wellness, student health, counseling, study skills. If you have a collegiate recovery program on campus, we encourage you to include that. Support groups, as well as a recovery ally, which is especially important for those campuses that maybe don't have a formalized collegiate recovery program. Identifying a person that could be considered a recovery ally on your campus can help connect students to recovery resources that may be available on your campus and within your community. So as we wrap up, I want to take a look at campus reports and some of the changes that we've made there. We really have cleaned that up a little bit, so I think you'll be pleased with the way the reporting looks, and we're excited about continuing to work with the campus reports to make this area a little more robust. So you have the ability to look at reports by an individual campaign. You also can look at them through your entire campus. So looking at the entire account's worth of campaigns, you can filter the date for a specific date range, or you can look at the life of the campaign or the life of your account. But once you choose what you're looking at for your reporting, you'll see a number of graphs. The first one being our screenings over time. So this is just a line graph to show you when screenings have taken place. You'll also see two pie charts that look at the students identified for screening, how many of them completed those screenings and how many of them are outstanding, as well as the overall risk level. So you see here a pie chart indicating what percentage of students were in that overall risk level. You can hover over those pieces on the pie chart, and a pop-up will show up showing you the raw number as well. You can see the overall demographics for all the people who completed that screening or all the people who have completed any screening throughout your campaign. So that's what we're taking a look at here is our gender question. And you can see in bar graph form both the raw numbers as well as the percentages of how people responded for the overall demographic questions. However, we also break down the demographics of each response. So I'm showing you this within question 1. So we show you the responses for each question, but we do this for the overall risk level as well. So you can hover over a section of the pie and see the percentage and the raw number. And when you click on a piece of that pie, then you'll see small bar graphs that show you the demographic information for that specific response. So of the 26% of people who indicated that they drink alcohol 2 to 3 times a week, about 60 of them are female. So we have those reporting questions. We provide pie graphs for all the questions within each of the screenings. We also do a compare opportunity so that you can look at 2 screenings side by side to see how those screenings might compare. So what are our next steps? If you're interested in learning more about ScreenU, if you're not currently a ScreenU member, we encourage you to visit screenu.org. You can sign up for a 7-day demo there where it'll give you access to an account that you can create campaigns and send those to your campus stakeholders. We encourage you to gather key stakeholders on campus and begin considering what kind of resources on your campus are available for students, and we are more than happy to provide a one-on-one demo or a demo for a small group of your stakeholders on campus. And you can schedule that by going to go.osu.edu/ScreenU demo. So we set up a time where we can speak with your campus, we can walk you through the program, we can provide demonstration links to stakeholders on your campus. We can discuss how campuses that are currently using ScreenU or participated in our year-long pilot, how they implemented the program. We also have a webinar on our YouTube channel and on our website that focused a little bit more on how to utilize ScreenU on your campus, and we encourage you to visit that webinar as well. You can find it on our website at hecaod.osu.edu in the webinar tab. If you're interested in learning more about becoming a member, I encourage you to reach out to us. Annual membership to the Higher Education Center includes unlimited access to ScreenU alcohol, RX, and marijuana, including all implementation and technical assistance materials needed. We also offer a number of additional membership benefits, including a member listserv. We provide a members-only web portal that has access to our Cannabis Learning Collaborative, and we'll have access to our upcoming Recovery Learning Collaborative that we're looking forward to launching here very soon, as well as technical assistance. Our membership rate is $2,500. And if you have any questions about becoming a member, I encourage you to reach out to us. We're really excited about Recovery Month coming up in September. Hopefully your campuses have started considering if you're going to be doing anything to celebrate Recovery Month. If you are, we'd love to hear more about what you plan on your campus, and you can reach out to us at hecaod@osu.edu. But we invite you to join us for our upcoming Twitter chat on Tuesday, September 26th at 2 o'clock Eastern Standard Time. We're partnering with Transforming Youth Recovery for our Twitter chat, and we would love to learn more about what you're doing on your campus to support students in recovery, because we know students do recover, and that's our hashtag for the event. So mark your calendars. We're really excited about it. And I think that completes our webinar today. I've added some contact information. We encourage you to reach out to the center. If you have any questions about what we've discussed today with ScreenU, I'm happy to answer those. You're welcome to send them in now. As we wait for questions, a couple other things that we want to mention that are happening with the Higher Education Center. We're really excited. We just announced last week, hopefully you caught it, our new director, Dr. Jim Lang, as well as the national meeting is coming back in 2018 in October 15th through the 18th at the Blackwell here in Columbus. We're so thrilled to be able to have another national meeting. We hope you mark your calendars and plan to attend. We'll have more details about the conference, the agenda, and the pre-conferences very soon. So it doesn't look like we have any questions right now. You're always more than welcome to send questions our way. You can email us again at hecaod@osu.edu. If you would like to learn more about ScreenU or how to use it on your campus, we encourage you to reach out. Thank you so much for joining us today, and we look forward to speaking with you soon.